Thank you, Dr. Neha and Sahani sir. Good evening, good afternoon, and good morning. This is the 1485th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. KHIROD Bisoi. We welcome all to this session. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over, our Hindi session from 7:30 to 8:30, and 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself. And those who want to watch our previous videos can go ahead and you can search at YouTube IFPH Homeopathy. And today we have a guest in Dr. Kirod Bisoi. He has completed his BHMS and now doing a PG, and that's why he's a PG scholar. So he is doing PG in practice of medicine at RBTS Government Homeopathic Medical College and Hospital, Muzaffar, Bihar, and has completed BHMS from Dr. Abin Chandra Homeopathic Medical College and Hospital, Odisha. The subject of discussion today is the importance of tongue in homeopathic clinical practice. As you all know, that the importance of tongue is very, very important, because we as homeopaths have looked into all part of the person to find out the right remedy, and of course the mouth itself give you an idea about the selection of your medicine. Of course, tongue is the best thing. The marking on the tongue, how it, whether it is dry, whether it is cold, whether it is having excessive salivation, whether it is offensive odor coming from the mouth due to some cracks in the uh, tongue, like that. So let us welcome the guest of the day, Dr. KHIROD Bisoi, to this session. We proudly welcome you, Doctor. Sir, please open your.
You have to make him the co-host, Dr. Kirod.
He has noted.
He has joined. He has joined.
In which name, sir?
KHRI.
Yes, I have seen, sir. Since I was made guest a little bit late, I couldn't find out.
Now he's the host.
Yes, please.
Namaste, sir.
Yes, welcome.
Namaste to all the guests present here, and good evening to everyone. A warm welcome to everyone in this IFPH seminar. At the beginning, I was very thankful to my teacher, Dr. Amit Sahni sir, and teacher of my teacher, Dr. M.K. Sahni sir, and whole organizers team, and IFPH team, and Dr. Dhanesh sir, who has given me a chance to speak in this forum. Today, I have a very important topic to discuss. The topic is use, and the topic is use on my tiny shoulders, I can say. So again, I thank all of you, and thank you, sir, for my introduction. So can I share my slides?
Yes, yes.
Okay. Is it visible, sir?
Yes, yes, it's visible. Visible now.
So today my topic is clinical importance of tongue in homeopathic practice. And my introduction, already sir has given me a good introduction. I am Dr. KHIROD Bisoi from RBTS Government Homeopathic and Medical College and Hospital in Muzaffarpur, Bihar. Presently pursuing my MD in the stream of Department of Practice of Medicine, and I have completed my BHMS from Dr. Abin Chandra Homeopathic Medical College and Hospital. And presently I am working on 2 research projects. One is on sciatica and another on the Tinea pedis generally consists of heel fissures, that one. So without wasting any time, it's going to be a huge session, and everyone will, I think, at the end of the discussion, will be able to identify their tongue, actually. So without any wasting any time, let's begin. As Sir has said, tongue is the mirror of the stomach. It reflects not only the digestive system, but also the cardiovascular system, the skin, and the fever, and all other such clinical conditions of our body can be recognized using a tongue. As the tongue reflects the patient as a whole, examination findings of the tongue should assume importance in prescribing. Perhaps this must be one of the reasons why in the olden days, Vaidyas and Hakims could prescribe by just looking at the tongue of the patient and examining the pulse of the patient. In Bengal, I have heard that few practitioners prescribe by just looking at the tongue and the nail changes also. So, J.T. Kent's repertory of homeopathic materia medica describes tongue under the chapter of mouth. William Borick gives a special chapter on tongue, and BBCR also, C.M. Boger has also given a chapter under the tongue, mouth. The modern school of medicine does not give so much importance to the tongue except for diagnostic purpose. The homeopathic approach essentially differs from this, as homeopathic physicians play a very important role in, the tongue plays a very important role in prescribing. So all these authors like J.T. Kent, Borick, and BBCR, the Boger one, has included, CM Boger has included tongue in their dictionary. Now coming to examination of tongue. So why examination of tongue is important? Now, as all of you know, when the Quality Control of India has visited your respective colleges in the month of this July or August time, they were asking about the examination of various systems like the respiratory systems and the cardiovascular system and all the respiratory. So I thought, why not include this slide in this topic? So in examination of the tongue, there may be a protrusion failure. The patient will not be able to protrude his or her tongue. It may be due to short frenulum. So this is a patient which visited me, and it was having a tongue tie condition, and the frenulum is attached to the floor of the mouth, and the patient was unable to protrude her tongue. And hydration, in the condition of, it's a condition of dry tongue. In cases of severe dehydration, the patient may also present with features like turgidity of skin, parched lips, and paleness, and everything can be found. And from mouth breathing in uveiparotid fever, such as Hereford syndrome, also found in cases of sarcoidosis, and excessive moist tongue can be found in conditions like heavy metal poisoning, arsenic, mercury, lead. So in Ellen Materia Medica also, it's mentioned that about mercury and cupromet also, they have a metallic taste, saliva. So this thing is mentioned because of this condition. And the encephalitis, Parkinsonism, and after use of lozenges, you can have the condition of this excessively moist tongue. Next, coming to fine tremor. It's a frequently covered AIPGT question. Where will you find the fine tremor? Where will you find the coarse tremor? So these conditions can be also found in the tongue. If it is a fine tremor, you go for thyrotoxicosis, anxiety neurosis, or the chronic alcoholism. And for coarse tremor, it's a case of Parkinsonism. So few of the AIPGT aspirants also would have joined this discussion. So I think everyone will gain something or the other from this slide or the discussion. Okay. Next, coming to spasticity, which will be found in the cases of pseudobulbar palsy. Next, deviation. It may be unilateral due to the seventh nerve palsy. If it's the upper motor neuron lesions, then the tongue is deviated to the opposite side. And if it's the lower motor neuron disease, the tongue is deviated to the same side. Next, coming to fasciculations in cases of wasting diseases, like if the lesion is on the hypoglossal nerve, Okay, if the lesion is on the hypoglossal nerve. Nuclear in the progressive pseudovalvular palsy, okay, or amyotrophic lateral sclerosis. As all of you know, Stephen Hawking, the great scientist, was suffering from amyotrophic lateral sclerosis. And the lingual hemiatrophy. Lingual hemiatrophy means a part of the tongue. Hemiatrophy, a part of the tongue will be atrophied, so the tip deviates to the side of the lesion. And the median raphe will be the concave, so will be in concave towards the lesions. Then coming to the color, this one, every layman knows the tongue will be pale in cases of anemic, blue in cases of central cyanosis patient, and angry looking red in color in cases of niacin deficiency. Niacin is which number vitamin, students? It is vitamin B3. Then coming to smooth and glazing patches in cases of syphilitic and leukoplakia. And the tongue may be dry with a central brown fur and red edges in cases of typhoid fever. What may be the conditions of papillae? The conditions of the papillae may be smooth with the help of atrophy of papillae, anemia, pellagra, or it may be pernicious anemia. And the tongue size may be large in cases of macroglossia and myxedema, acromegaly, and it may be atrophy or microglossia in cases of pseudovalvular palsy. Now coming to ulcers. It may be snail track ulcers. When a snail travels in the sand, it leaves a path behind it. So the snail track, it is known as the snail track ulcer. Similarly, if the snail track ulcer is found in the tongue, it may be due to the conditions of secondary syphilis, or the white patches with ulcers may be found in chronic superficial glossitis. If the conditions of congenital fissure and chronic superficial glossitis may be differentiated by presence of normal papillae, and tubercular ulcers may be present in the dorsum of tongue, and the malignant ulcers which may be associated with the leukoplakia, and the frenal ulcers which is found in cases of whooping cough. And in taste sensation, anterior two-thirds of the tongue, if it is disturbed, then it is due to the lesion in the geniculate ganglion, which is generally caused by herpes zoster. And in the posterior one-third of the tongue, it carries the glossopharyngeal nerve, causes the loss of taste sensation. It was a question when I gave the AIPGT 2022. The posterior one-third of the tongue, which nerve supply carries that sensation? So it is carried by the glossopharyngeal nerve. So now coming to the interesting part of this discussion, different presentations of the tongue. We will cover this topic in terms of discoloration, pain, and swelling. Okay, first coming to the discoloration. The tongue may be dry, brown, and slightly furred tongue. Furred tongue. What do you mean by furred? It is furring of the tongue is due to heaping of the squamous epithelium on the filiform papillae. Why does it happen? It happens due to inadequate cleansing of the tongue. So, my dear participants, clean your tongue twice a day along with your teeth. Okay, next coming to the rubrics. If I go on writing the medicines for every rubric, it would be a huge discussion and it would be a never-ending slide. So I haven't mentioned the medicines here, and I have just given the rubrics in terms of Kent's repertory and Borik's repertory, or the repertory of tongue by M.F. Douglas. You can go through it. Okay. Next coming to brown and dry tongue. Brown and dry tongue can be found in patients of smokers, and in patient of chronic kidney diseases, uremia, ketosis. Okay. Next coming to yellow coating tongue will be found in cases of jaundice, poor oral hygiene, tobacco use, or dyed foods. One day I was sitting in the OPD, a patient, it was a hot summer day, a patient visited me after drinking Resna, and the tongue was angry looking red. So be careful while examination of the tongue, and ask the patient whether he has consumed any dyed foods or not. Okay. So, here the slide is of a person who was suffering from chronic dyspepsia and was having a yellow colored tongue on the base. Okay. On the base of the, or the posterior portion of the tongue. So I have given him Nux vomica. And why I have given him Nux vomica? Because there is a very useful book. The name of this book is The Tongue That Doesn't Lie. and it was written in 1987-88 time by Prakash Vakil. You all heard of Prakash Vakil, right? And I found in his book, so I have included that slide also here, that Nux vomica has a posterior yellow coating tongue. I have read that book and it is a very useful book, but it was edited in 2003 and it was made and it was printed way back in the 1987. So I thought, why not add that new pictures to that book? So I thought of keeping these pictures. My only aim in while studying about tongue is to add new pictures to the Prakash Vakil, the tongue that doesn't lie, to that book. Okay, why? Because the book is an old one and the pictures are also not clear. As you can see in my slide also, the pictures are not clear. It's a very old book. So I thought of adding new pictures in by looking at the patients in OPD. Now coming to black hairy tongue, which is found in cases of antibiotic therapy, smokers, poor oral hygiene. So the rubrics may be mouth discoloration, tongue black in Kent's repertory, mouth, tongue. So you can go through the rubrics, and it's a very common drug of arsenic alba, which you give for black tongue. And there is also black tongue mentioned in other drugs, which you will study in the further slides. Next is black discoloration. Black discoloration, as you can see in my slide, children, black discoloration of the tongue. And this patient who visited me to the Obs Gynae department in the RBTS Medical College was suffering from PCOD case, and she had acanthosis nigricans. So I have included in the slide also, in cases of tetracycline, bismuth, antidepressants, or the Addison's disease, or the acanthosis nigricans cases, you can find like this type of black tongue cases. Okay, it may be, usually we don't pay attention to the tongue. Any patient, whether he is suffering from the fever, whether he is suffering from vitiligo or anything, peptic ulcer disease, you please look at the tongue. You may get a fair idea about the totality of the drug. Or if you are confused between which to, whether to go for arsenic or whether to go for Nux vomica, then you can look at the tongue of that patient. Okay, you will get a fair picture which to choose. Next, coming to geographic tongue. As you can see in my picture, there is a boy who has a tongue with map tongue. Okay, that is geographical tongue. It may not be of the India map, but it's of some country, you think. And the tongue is due, and this geographical tongue is due to the loss of filiform papillae from the dorsum of tongue. Okay, it may be found in cases of celiac disease, psoriasis, lichen planus, and nutritional deficiency. As I have said, as I was looking for the tinea pedis cases, I have found this tongue in the pediatrics department of my college. Okay, and that you can see the rubrics. Next, coming to that, at below you can see 4 pictures, right? The first picture is of a female. She visited me with complaints of acne. She was having acne, and you can see in her tongue, a part of her tongue is denuded, okay, or it is removed, or patch one. Next, you can see another patient was also suffering from tinea corporis, and she was having a very peculiar symptom. She was having burning of tongue. So people may be having a burning of feet like meadow, sulfur, these all, but he was having a burning of tongue symptom. Next, another patient is leukoplakia patient who visited by OPD after getting failure in AIMS Patna, and is a leukoplakia patient and is now doing well with remedy sulfur now. Okay, he's under my treatment now. So you can see his tongue. So geographical tongue can be found in various cases. So I have given, I'm not here to explain you about other cases. Just I'm showing the tongue of geographical tongue, tongue in different cases. Okay. Next, coming to fissured tongue. So it's a, you can see fissured tongue here. It may be found in Down syndrome, or it may be found in Melkerson-Rosenthal syndrome in cases of facial palsy or orofacial swelling. Okay. And orofacial granulomatosis also. So first picture is of a patient who visited me with complaints of tinea. and is having such a geographical tongue. And I will show you similar tongue is given by Prakash Vakil under the drug nitric acid. Similar tongue. Okay, but I thought it's a Fisher tongue, so I should show you here. Next is the patient of Fisher tongue, and the patient was normally suffering from low back pain, and he's having Fisher tongue. And in the middle is the patient is an army. He's an army officer presently serving in Uttarakhand, and was suffering from vitiligo. But his tongue, look at his tongue. The tongue is very clean, but it is fissured. And at the last is a patient of DNS, deviated nasal septum, and her tongue has a central furrow with other fissures also. Okay, so central fissure is marked in this patient, just like in cases of syphilinum and in cases of nitric acid also, you will find a central furrow. Next, coming to white patches or hairy white patches in lateral border or dorsum of the tongue. In cases of it, you will find this symptom in cases of leukoplakia, hairy cell leukoplakia in HIV patients, and the rubrics are in Kent's repertory and the repertory of tongue by M.F. Douglas. You can see the white edges are found in kali sulfide. Creamy white curd you can find in cases of candidiasis, HIV sick infants, or in cases of antibiotic therapy, like patches occur on the skin and other areas of the buccal cavity also. Okay, so the rubrics may be like this, and the tongue may will be looking like this with a white patch. Okay, I have tried to give you sufficient images to get an idea of different types of tongue. So the pictures will be very abundant in my slides. Next, coming to blue tongue. Blue tongue will be found in cases of central cyanosis. Okay, Kent's repertory, you will find this blue tongue, and in repertory of tongue by MFWS, you will find blue is red. Okay, so these are the two patients. I will say about their story when I will make you study about their drugs, or when I will discuss with you about the drugs. Okay, next is beefy red tongue of pellagra, and in magenta is which color? The magenta is nothing but the color which I have highlighted written magenta, which same color is of the magenta tongue. Okay, due to riboflavin deficiency or vitamin B2 deficiency. The tongue may be pale, red in color, painful, featureless tongue. It may be found in cases of anemia, pernicious anemia, severe iron deficiency anemia. The tongue will be pale, as all of you know. So these are the pictures of the pale and featureless tongue. We have completed the discoloration part. Okay, now coming to the pain component of the different presentations of tongue. Okay, so first is injury to the frenulum linguae will have a pain, and ranula. What are ranula? Ranula are nothing but the mucosils that are the majorly of the salivary glands, and that originate the floor of the mouth. You can find this ranula word in our Allen's Materia Medica in cases of thuja or in cases of ambrosia. Okay, so these are ranula. Next, coming to calculus. It may be due to a salivary calculus or due to the blocking of the salivary gland. So here in the picture, the salivary calculus shown here is of this submandibular gland, or it may be due to the foreign body in the tongue. The pain will be due to foreign body, since anything foreign substance in the tongue, or you due to myositis. As you know, our famous heroine Samantha is suffering from myositis. So myositis will also cause pain in the tongue. So these are the rubrics. Next, coming to in cases of trichinosis, you will find ulcers in the buccal mucosa due to trichinella spiralis infestations or infections. Or when the pain appears to be upon the surface of the tongue, even if it is also affects the tongue as a whole. So it may be due to the conditions of beaten tongue, or after an anesthetist putting that mouth gag to prevent the patient from shouting, and the injury by tooth or the dental plate. Now everyone is wearing that strings to for the cosmetics purpose of their teeth. That is also causing a injury to the tongue. Or the antibiotic glossitis caused by various antibiotics, generally amoxicillin. Okay, and in cases of Jayashree ma'am. Okay, I will discuss about the drugs in the later part. Already there is a slide. So first of all, I'm thinking of discussing about the various presentations. Then go to the organon part. Then go to the materia medica part. Then discuss the case. So you will get the whole lot of packets. Just be patient. Next, coming to the congenital fissure tongue. And then coming to the geographical tongue. Already you have discussed about the geographical tongue. So in cases of geographical tongue also, you will be getting some type of pain. Okay, next coming to median rhomboid glossitis. Okay, median rhomboid glossitis. And this is the image of the median rhomboid. Median matlab in median means in the middle. If you will get the glossitis in the middle, is known as median rhomboid glossitis. And why is that glossitis occurring? It is occurring due to the central papillary atrophy. Okay, next coming to Moeller's glossitis. I have a case of Moeller's glossitis. We will see in the subsequent slides. Okay, and the Moeller's glossitis, see, just look at the picture how it is. Moeller's glossitis. It is also known as the atrophy glossitis, or it may be known as the ball tongue. It may be known as the smooth tongue Hunter glossitis, or the Moeller-Hunter glossitis, or smooth glossy tongue. As everyone has now the synthesis repository in their phone, right? You can find about the tongue in the mouth section, tongue glossy. Okay, that is nothing but of the Moeller's glossitis. Okay. And these are the, I have said about my cases, right, of the Moeller's glossitis. It was a case of Moeller's glossitis, which got the totality of arsenic, and the patient is now relieved of his symptoms. Okay, so glossitis may be due to the deficiency, or due to deficiency diseases like niacin, I have said, riboflavin, all the deficiency diseases, and smoking, bad effects of over hot beverages or foodstuffs. Generally we are very fond of chai. So while drinking chai or coffee, you get this kind of stuffs, or the effect of pungent condiments such as the cayenne pepper, or the minor viral diseases also present with Moeller's glossitis. Okay. Now coming to the swelling part, we have completed the discoloration. Next, the pain. Now coming to the swelling part, the swelling. The causes of this acute swelling may be due to the bite or the stings of any insects, or the injury generally while eating. South people while eating, generally fish bone, or biting during epileptic attacks. It's a very common presentation nowadays. And corrosive or the acute irritant applicants, or the due to acute edema, or due to certain drugs like the mercury, aspirin. Okay, and I have given here a case to see the tongue which is swollen in cases of, and it was a case of pemphigus vulgaris. Okay, and the patient was a poor rickshaw driver. He visited me, and he was not having money to visit higher centers. So I have treated him first by giving Myristica, which got aggravated. Then he was bit relieved after giving Cifilinum. So he's doing good now in Cifilinum. So you can see at his tongue, he's having a tongue which is swollen, and the eruptions of pemphigus vulgaris, which is autoimmune disease, is also found in his tongue. Okay, it is found all over his body. So we are not here to disclose the identity of the person, but as I have to show you the eruptions of pemphigus vulgaris, I have included his face also. He's having eruptions on the whole body, and the eruptions are generally vesicles, and the vesicles rupture after producing a watery and oozy fluid, and later while taking out his shirt also, he was finding it very difficult to remove his shirt, because the shirt was sticking to his body. I have seen him, and the patient was miserable when he visited me, and still his eruptions persist, but he's not so severe. And he also mentioned that people are refusing to sit in his auto rickshaw after seeing this patient of pemphigus vulgaris. Such was his terrible condition when he visited me. Okay. Next, coming to the swelling may be due to serum injections, and other conditions like giant urticaria, angionuretic edema will be having this type of tongue presentations. Okay. Next, coming to chronic swellings. Now we have covered the acute swellings due to the during convulsions or epilepsy attack, during the bite, during eating fish bone, everything. Now coming to the chronic one. Chronic one will be due to macroglossia. Macroglossia, why that is occur? Macroglossia due to lingual muscular hypertrophy or due to glandular hyperplasia, or in cases of congenital hypothyroidism, or in cases of myxoedema. So I have included these pictures by taking it from the internet. So you can also Google it out. So there is nothing new to learn from this. Just remember the conditions. Okay. Next, coming to Mongolism, which is the Down syndrome, the genetic disorder caused by the chromosome 21. In cases of acromegaly, when we think of acromegaly, one picture comes to your mind of that great Kali. Everyone know great Kali. He has such large hands. He has frontal bossing. He has a large nose. He has large lips. Okay, and acromegaly comes to a picture. So in acromegaly also the patient will be having everything large, so the tongue will also be large, and the acromegaly is caused due to the growth hormone excess in generally after the epiphyseal growth fusion plates. Okay, after the fusion of epiphyseal growth plates, if the growth hormone is rising, it causes acromegaly. If it is happening before, then it is gigantism. Everyone know it. Okay. Next, coming to primary amyloidosis. In cases of primary amyloidosis, the amyloid proteins, that is the beta sheet fibrillary proteins, gets deposited in various tissues such as the liver, spleen, kidney, heart, nerves, and blood vessels, causing it a variety of symptoms. And the patient also presents with cardiomyopathy, hepatomegaly, proteinuria, macroglossia, and autonomic dysfunction. So he will be having these features in the tongue. Okay. Next, coming to local or asymmetrical swelling, or in cases of leukoplakia or in tubercular infiltrations also will have various types of swellings. Next, coming to actinomycosis. It is an uncommon chronic suppurative bacterial infection affecting soft tissues caused by an anaerobic filamentous positive bacteria, that is Actinomyces israeli. Okay, so I don't know whether it was actinomyces, but I found it similarly like actinomycosis, and I have given you the picture before and after picture. The person was having a black, at the tip of the tongue, you can see a black eruption was there, and it got disappeared. Okay, in these conditions, which drug I have prescribed? As you know, I have prescribed the patient argentum nitricum. Why? Because just the patient showed me, I was having a less knowledge at the time about the tongue. Just I found that elevated papillae, the papillae were erect. So when I search about this rubric, elevated papillae, I got two drugs. One is argentum nitricum, another was belladonna. Okay, so I found argentum nitricum in this case more suitable, and the patient is, and the result is here. Okay, and after studying deeply, that is the tongue doesn't lie, the Procas buccule, I have found argentum. It has also given in both in argentum nitricum as well as in argentum metallicum also. What does it write? Enlarged papillae with whitish yellow coating. The papillae is enlarged, but in boric it writes the papillae are elevated, papillae is erect. You can get the rubric papilla erect. Okay, in the tongue section, papilla erect, you can get the rubric argentum nitricum and belladonna. Okay, and next, coming to calculus in the sublingual salivary glands. Okay, as you can see in this picture where the arrow points. Okay, next is suprahyoid cyst can also present you with tongue swellings, and in cases of sarcoma also, Kaposi sarcoma of tongue, alveolar soft part sarcoma of the tongue is a highly vascular tumor which is found in the tongue. Okay, it presents as a painless, slow growing mass. Okay, I had a patient of suprahyoid cyst, and the suprahyoid cyst of that boy, actually he was a boy of 16 years. He visited a pediatrics department of RBTS, and my senior was treating him. Actually, that suprahyoid cyst was black in color. After giving him lachesis for 2 months, we have prescribed only twice in those 2 months. The color of that cyst changed from that blackish color to similarly the red and vascular color. Okay, but the boy was also having loss of voice, but we were we were not able to restore the voice of that old boy, okay, that boy. But just I have seen the color change of that suprahyoid cyst in my OPD, and it was being treated by my senior actually. Next is hemangioma or lymphangioma. They are nothing but the endothelial cell proliferations. This is the picture of hemangioma, or it may be lipoma. Lipoma, as you know, lipoma can be found everywhere, and they are what they are. They are generally form fluctuant, and they exhibit slip sign. If it is found in the tongue, it may be due to a chronic swelling. Okay, but I have never come across lipoma in tongue. Next, these are the rubrics which is found in Kent's repertory, Boric repertory, and the repertory of tongue for chronic swellings. Okay. Next, coming to ulcerations. Ulcerations may be present due to the carcinoma, which is the most common carcinoma which occurs in the oral cavity. It is nothing but the squamous cell carcinoma. And the risk factors of the squamous cell carcinoma is smoking, alcohol, betel use. So, during the start of every movie in the theater, you get this. Smoking alcohol, to prevent people from smoking alcohol, you get a advertise. Okay, so prevent yourself, be a good physician. Radiation exposure, immunocompromised like the HIV people, and the poor oral hygiene, genetic factor, human papilloma virus infections will also have various ulcers. And in cases of syphilis, I have differentiated here primary syphilis, secondary syphilis, and tertiary syphilis and its presentations. Primary syphilis or canker is rare on the tongue. Okay, more common, and the primary syphilis is more common in men than in women. In cases of primary syphilis, a small pimple ulcerates and become indurate. First, it will be a pimple which get indurated, and the induration is not so marked as when it is situated on the glans penis. So it is more marked on the glans penis because it is a STD. Okay, appearance of secondary rash with generalized enlargement of lymph nodes indicate the true diagnosis. And the positive serological test, VDRL test, okay, as all of you know, and the spirochetes in serum also will be found in cases of syphilis. Next, coming to secondary syphilis, manifests itself by the formation of mucus patches, as you can see, and superficial ulcers, as you can see in this picture, multiple and situated along the edges or the tip of the tongue. The ulcers are small, round, painful with sharply cut edges and grayish floor. Okay. Next, coming to tertiary syphilis or the gummatous ulcerations. These are the picture of that gummatous ulcerations. It may be a superficial gumma or maybe a deep gumma. The superficial gumma will be small, round cell, and the deep gumma will be the hard swelling on the tongue. Okay. And the dental ulcers. Dental ulcer is due to repeated small injuries. As I have said, everyone nowadays are using the braces for the cosmetic purposes. So it may lead to formation of dental ulcers in the long run. Now coming to tubercular ulcers, usually present at the tip of the tongue or the dorsum of the tongue, and in the anterior half. It is generally painful, sometimes painless. Okay, the edges are thin and undermined. The base may be covered with pale granulations. Okay, the repertory of tongue gives various rubrics for the syphilis and the tubercular ulcers. Okay. Now coming to other tongue manifestations which are very rare: hereditary hemorrhagic telangiectasia, or maybe in cases of caviar tongue. Caviar tongue is nothing but varicose veins. Okay, varicose veins that is sublingual varices. Look like the varicose veins in the tongue are known as nothing but caviar tongue. Next is tongue tie. At the beginning of the discussion, I have showed a patient of tongue tie, and to say you, there is only one medicine for tongue tie in synthesis repertory, that is syphilinum. Okay, I had given syphilinum to that patient of tongue tie, but I couldn't see any improvement. But I have found one case of tongue tie. So this is how the tongue tie patient looks. And the patient was similarly looking like this, and was unable to retract her tongue back, actually, similarly like this in the picture. At the beginning of the discussion, I have showed you tongue tie, short frenulum, and the frenulum is attached to the floor of the buccal cavity. So the patient was unable to protrude her tongue or retract her tongue. Okay. Next, coming to the miasmatic background. miasmatic background, as you can see, it will be a boring discussion if I'll say you line by line about what are the features of the tongue in cases of latent SORA. So you can take just a screenshot if you want to read about, and it is taken from a very good book, that is PS Fight, Comparative Analysis of SORA, Syphilis and Psychosis. Okay. Next is miasmatic background of SORA, psychosis, syphilis. Just you can take a screenshot if you are interested, or else you can skip this. Next, coming to your favorite one, the Metria Medica part, which you have been waiting since a long time. Some characteristic tongue indications from Metria Medica. In cases of Anantherinum muraticum, as you can see in the picture, the tongue is fissured. Where? At the cut edges of the tongue. With the patient is having copious salivation. As you can see in the picture, the patient has salivation and there are cut edges. Next, coming to untincrude. Who doesn't know about the untincrude tongue? Because it's mentioned in LN in the bold letters. Milky white coating tongue is the red strand of this remedy. Okay, so untincrude patients. Okay, this is the tongue of untincrude. Just pay attention to that untincrude tongue. Okay, why? Because similar type of tongue will be found in chelidonium also. So I am asking you to pay attention. In cases of untinctart, the tongue is red and dry, especially in the center. Okay, red and dry. Everyone knows about the extraordinary craving for apples, right? So you won't forget about it. But red and dry, especially in the center. Similar type of tongue is also found in Veratrum viridae. Okay, I repeat, similar type of tongue as that of the untinctart is also found in Veratrum viridae. So be careful while choosing Veratrum viridae or untinctart. Okay. Next, coming to arsenic album. Arsenic album, the tongue will be dry, clean, and red. It's a boric lines. Okay, you can also find it. Stitching and burning pain in the tongue, ulcerated with a blue color. Ulcerated with a blue color. You just remember that line, ulcerated with a blue color, because I have a case of ulcer with a blue color margins. Okay. Next, coming to belladonna. When you talk of belladonna, we talk of strawberry tongue. And all of you know where you will find the strawberry tongue in cases of Kawasaki disease. Okay. Kawasaki disease is nothing but a medium vessel vasculitis. And the belladonna tongue will be red on edges and it is strawberry. Strawberry means just all of you have seen strawberry. They will be just like dots on the tongue. Okay, strawberry tongue, as you can see in this picture. And just like the strawberry, it will be swollen and painful. So whenever you think of belladonna, think of strawberry. Just think of strawberry. Okay, strawberry tongue. Epismel. The tongue will be fiery red, swollen, sore, and raw with vesicles. And the tongue feels scalded, red hot, trembling. And it is very useful in cases of cancer of the tongue. Okay, as you can see, it just looks like which tongue? The pyrogen tongue. It just looks like the Crotella sordidus tongue. It just looks like the terebinth tongue. Okay. Next, coming to bismuth tongue. In bismuth, in cases of bismuth, just look at the gangrenous looking edges. I have never found such patients, so I have included which is found in the pictures, which is found in the internet only. Okay, so tongue is white, swollen, black, gangrenous looking edges on the dorsum or on the sides of tongue. Next, coming to the bryonia tongue. The bryonia tongue is dryness of tongue, tongue coated yellowish, dark brown, heavily white in gastric dearrangement. Okay, I have found one case here. As I have already said you, I am working on sciatica and tinea pedis. So in cases of sciatica, and the patient was having right-sided sciatic pain, which was getting aggravation by motion, but I was not able to decide whether to go for bryonia or whether to go for lycopodium. But after looking at his tongue, I was sure that I should give bryonia, just because, just look at his tongue. It's a white tongue and it is slightly yellow at the posterior portion. Okay, so it has matched bryonia picture, heavily whiting gastric dearrangement. That's why I have given bryonia, and the patient is now very much fine, just doing physiotherapy and is on just on rubrum. He's on rubrum since 2 months, just by single dose of bryonia, just because of the tongue picture. Okay, so tongue plays a very important role. My dear participant, just pay attention. It plays a very important role. Next, coming to the Chelidonium majus, the tongue yellow with imprints of teeth. I have already said that tongue is large and flabby with imprints of teeth. Chelidonium has imprints of teeth. There are numerous drugs with imprints of teeth, just like Rustox, just like petroleum, just like hydrostis, Merxol, podophyllum. There are numerous drugs with imprints of teeth, but the tongue should be large and flabby. Okay, large and flabby with imprints of teeth. Next, coming to calcareous sulf. Calcareous sulf, remember the word, layer of dried clay. Okay, resembling a, you can say in the picture, layer of dried clay. Okay, next coming to Ailanthus glandulosa. It's a boric drug. The tongue is dry and brown. As I have talked about the brown color, so just I have written there, but I have no pictures to show the tongue of Ailanthus glandula. Just remember, the tongue is dry and brown. But in calcareous sulf, you have a dried clay tongue. Okay, clayey tongue. Like someone has taken few mud, as it is a rainy season, few pinch of mud and rubbed on his tongue. Okay, clayey tongue. And the carbo-veg, the tongue.
Hello, doctor. Hello, doctor. How much slides remaining? How many slides remaining?
Maybe 20 something. No.
So I think we can stop somewhere here and then we can have a second edition, because this is a very, very good session going on, and you cannot finish it in time. We have some other session coming on. People may have doubt, and all those things you described here was
Okay, sir. Can I finish in Metria section? Just Metria section, can I finish?
Yes, yes, yes.
Okay.
Then we can have a second edition. Yes, definitely we need one more presentation of the continuation.
Okay, sir. For the case presentation, I will do it afterwards. Just finish in Metria one.
Okay.
Okay. Okay, in carbo-veg, you have a tongue coated white or yellow brown covered with aphthay. Okay, you have studied of aphthay in cases of borax, muxal, but it is also found in cases of carbo-veg. Castoreum canadens. Okay, let me say you a story. My interest for studying about tongue began from this old boy, who is a 16-year-old boy, came to my OPD with milia. Actually, he is a phosphorus child. I have cured his milia using phosphorus, but he was having a eruption. He was having an eruption at the tip of the tongue. Can you see? At the tip of the tongue. And after giving phosphorus, I was unable to cure that case. And after prescribing Castoreum canadens, which is not found in my locality, so the actually the patient was not able to get the drug Castoreum canadens, so he's not actually didn't get the medicine of Castoreum canadens. And after a few days, when I was taking patients for sciatica, I got this patient. He was also having a eruption at the tip of the tongue. So my study interest for studying about this tongue topic began from this case. Okay, from the old boy who was suffering from milia, 16-year-old boy, who was a phosphorus patient, was remarkably cured of his milia, but still he was having a pea-like size of a pea. So in Castoreum canadens, I found, when I studied deeper, I found that elevation in the size of a pea in the center, which is found in Castoreum canadens. Okay, so you won't forget after this. Okay, next coming to causticum. Everyone knows paralysis of the tongue is found in causticum and cuprum, but tongue is red in the middle and sides coated. Okay, you have found clean tongue with red in the middle in cases of Veratrum viridae and in cases of tuberculinum. Next coming to cobalt metallicum. Cracks across the tongue and the coated white. Okay, as you can see, cracks are across that. But I have, for the second patient, the tongue is, various cracks are there in the tongue. I have given him nitric acid. Okay, and the patient is fine with nitric acid. But cobalt metallicum had, I didn't prescribe him cobalt metallicum. But for first patient, I have prescribed cobalt metallicum as he was suffering from low back pain. Okay, in chin in arch, you can see thickly furred yellow color tongue. Okay. Next coming to fluoric acid tongue, it is fissured in all directions. Okay, fluoric acid tongue is fissured in all directions. In the first picture, there was this tongue, and the patient actually is not able to speak properly due to the pain in the tongue and is having various blisters on the tongue. Okay. And when I inquired about her history, she said that actually her husband had died and her son is suffering from chronic kidney disease and is undergoing dialysis every week. Okay, so first I prescribed nitric acid. Nitric acid failed, but then I prescribed lycopodium. Why I prescribed lycopodium also is there in my slide, but the patient is getting relief from fluoric acid. To my surprise, it is getting relief from fluoric acid. Okay, next coming to the Kali bichromosome patient. This is the case of Kali bichromosome patient. Already I have said at the beginning of the discussion. The tongue is mapped and red, shining, smooth and dry with dysentery. And the tongue is broad. As you can see, the tongue is broad and indented, thickly coated. Feeling of hair and tongue is found in sanicula, natremure. But this is a Kali bi. Okay, the tongue is broad and indented and showing geographical tongue. So this is a case in the 14-year-old boy with eruptions in groin, buttocks and foot with intense itching, followed by burning, aggravation at night. And the provisional diagnosis was tinea corporis. Okay, tinea corporis, and was treated with Kali bichromosome. It had a remarkable region. Just I am showing the picture of his tongue, but you can see I have also the picture of his body of tinea corporis getting cured by Kali bichromosome. Okay. Next coming to lachesis. In lachesis, the tongue is swollen, burst, trembles. As everyone knows, it is mentioned in the patient is unable to protrude his tongue out, but you will never find that picture very oftenly. But while going through this, the tongue doesn't lie. I have found red tip with bluish blackish discoloration. When I was taking patients for sciatica of the right sided, I have found this tongue is, look at this tongue. He's having a bluish blackish pigmentation on the edges and the tip is red, and the patient is getting cured from lachesis 200. Okay, by 4 doses. Okay, is cured of sciatica. Next coming to nux vomica tongue. As I have shown at the beginning of the discussion, the next nux vomica tongue, a patient suffering from dyspepsia and is relieved by nux vomica because the tongue is coating posteriorly. Okay, the tongue is coated yellow on the posterior surface of the tongue. Okay. Next coming to pulsatilla. Pulsatilla is yellow or white coated tongue with tenacious mucus. Actually, I have just given this picture to show you tenacious mucus, but that patient was cured from natremure because natremure also tenacious mucus. Okay. Next coming to ranunculus sclerotus, where you will have a denudation patches on the tongue, just like this. Okay, I have also given a patient of acne, as I have already said, ranunculus sclerotus, and he is cured of acne using ranunculus sclerotus just because I looked at his tongue. Okay, next coming to lycopodium tongue. I have already said blisters on the tongue. There will be blisters on the tongue. Okay, next coming to Merck's sole. Look at this picture. Old boy visited me with this feature. The teeth is indented, the tongue is indented and feels as if burnt with ulcers. Okay, so it's Merck's sole tongue. Okay, Merck cyanotus, the tongue is pale, just tongue is pale. Okay, next coming to Merck dulcis, the tongue is black in color. As I have already said, it's a case of acanthosis nigricans and the tongue is black in color. And Merck iodatus flavus. Okay, as I have already said, it's a Merck iodatus flavus is also having a, just like a nux vomica tongue, posteriorly yellow coated with imprints of teeth. Nux vomica doesn't have imprints, but Merck has imprints of teeth. So Merck protoiodo will have imprints of teeth, but yellow coating on the posterior surface. Next coming to morphinum. Morphinum is tongue dry, brown, violet in the middle, just like the picture in the lady's picture. Okay, next sickle curve, tongue dry, cracked, blood like ink exudates, just like these pictures. Okay, just like ink exudates. Okay, this is a patient of paralysis, visited my OPD, and what did I prescribe? Do you know? I have prescribed her opium, and she is bit improved, but not totally cured. I have prescribed opium because opium also has black tongue, as I have said at the beginning of discussion. Okay, next coming to muriatic acidum, you will have deep ulcers on the tongue. Okay, in natrum phos, you will have these features of thin moist coating on the tongue. Okay, next coming to nitric acid. Nitric acid has a central furrow with painful pimples on the sides of tongue. But syphilinum has a furrow, but it doesn't have painful pimples on the sides of tongue. Okay, so in nitric acid, in Tongue Doesn't Lie, in that book by Prakash Vakil, also shows this picture. Okay, next coming to Crotalus horridus. Look at this picture. It's an interesting case. Crotalus horridus. At the beginning, I thought that the lady is doing it deliberately. When she was taking her tongue out, the tongue was automatically deviated to the right side. Her tongue was deviating to the right side. I thought the lady was doing it deliberately. But later I came to that whenever she protrudes the tongue, her tongue deviates to the right side, which is found in Crotalus horridus. So it's an interesting case. You can see tongue when protruding goes to the right. As you can see, the tongue is small, red, and the tongue is fiery red in the center, smooth and polished tongue. Okay. And in Daphne indica, the tongue is coated only on one side. It's a AIPCT question. And Rustrux and Daphne indica. Okay. And in Natromure, all of you know about Natromure. I need not mention it. Just look at the slide. And I have said tenacious mucus is found in both in pulsatilla and in Natromure also. Okay. Next, coming to Taraxacum. Taraxacum will have features of tongue just like ranunculus scleratus, and it's the picture of ranunculus scleratus lady suffering from acne, getting treatment by ranunculus scleratus and getting cured. Next is Ruxtox. Everyone knows about Ruxtox. Triangular red tip tongue. So I did not mention. Next is Pyroxene tongue. It is devoid of papillae. Okay, smooth and glossy. Next, coming to Thuja. Thuja, you know, ranula will be there, and Veratrum viridae already I have mentioned. Okay. Next is Sanicula. The tongue will have burning when protruded, will feel cold. Sulfur already I have showed, and syphilinum already I have said in nitric acid. Okay. So this is the end of my discussion in Metria. I was a bit fast. So please apology for that. Thank you, sir.
Yes, definitely. You deserve kudos because you have shown the power of your knowledge, and it is something you are just like a professor coming over here and giving, sharing his experience. So much of intense knowledge you have. You have took a lot of effort in producing such a wonderful session here, and that really, as if it shows that you have more than some 25 years of experience in this field. That was the power of your presentation. Congratulations. And we need some more presentations in the future. Of course, we can have a second part of the same because things went in a very fast and nobody could follow because that was the kind of rush you were showing in the just like going like 100 miles per hour while riding in Indian roads, not in Western roads. That kind of difference. Anyway, now since there is only just 2 minutes remaining. Well, really, this kind of presentations are worthwhile for all those who heard, and not only that, there will be a lot of people who may benefit from this presentation because we are uploading the videos tomorrow itself, and you can share with your friends as well as your professors also, because this itself is enough for you to get a PhD. That was the power. The energy, your determination, everything was there in your presentation. I invite Dr. Devi Ambadi to say a few words on this, and then we have to conclude the session. Dr. Ambadi can say a word of thanks also.
Oh, can you hear me?
Yes, yes.
Okay. See, Doctor, very good presentation. See how nicely you have presented it. The picture, we will not forget at all. And the therapeutic field also you have touched. Then thank you a lot. It was a very good presentation. We expect more classes like this. Okay, thank you.
Thank you.
Since there is no time for discussion, we will have to wind up the session. Tomorrow we will have a session from Dr. Rajat Chattopadhyaya, the principal from Calcutta Homeopathic Medical College. And so we'll be talking about homeopathy and dermatology. That's another big subject coming on tomorrow. Hope all of you will be with us tomorrow the same day. Thank you. Thank you.
Ganesh, 1 minute.
Thank you.
Ganesh, 1 minute. Ganesh.
Yes, you can speak.
Okay, doctor, you have taken a lot of pressure to present these slides. Thank you a lot.
Thank you.
That I have
Thank you.
mentioned.
Good. Keep it up.
Dr.
Okay.
Thank you so much.
Dr. KHIROD, you really went to everybody's heart in from your presentation.
Correct. Yeah,
Really
correct.
the hearts of the
We'll
people
never
here.
forget the
And not
pictures
only
of
that,
sun.
there will be more viewers for the presentation in the YouTube also. Thank you, Dr. KHIROD, and those who attended the session. I hope all of you will be back with us tomorrow at the same time. Good night to all. Thank you.
Thank you, sir.
It's over to Dr. P. Shaila to moderate the Malayalam session.